You're watching HCAM TV.
And hello, Hopkinton, and welcome to the Thursday edition of the Hopkinton Hangout Hour. I'm your host, Mike Terosian, and today is Thursday, September 10th. And being Thursday, that means it's time for the Board of Health update. And joining me today, my co-host, Bob Hamilton. How you doing, Bob?
Hi, Mike. I'm looking forward to it.
Excellent, great. And going solo and holding down the fort over there at the Health Department is our director, Shaun McAuliffe. How we doing, Shaun?
Pretty good, thank you.
Excellent. So big week coming up. Here it is. It's Thursday, and got a few things, just a couple things going on in town, like I don't know, annual town meeting, start of school, and so let's start off with the annual town meeting. Where are we at with that?
I think we're in a good spot. You know, we have the tent. They should be completing the tent installation today. We're just taking care of some last minute adjustments because it should be a pretty good day weather-wise. I'm bringing some additional tents to help shade the volunteers that are working. So we're just working out those little details, and we Deputy Miller and I will be out tomorrow marking out all of the chair locations. If you're looking to speak during the meeting, we'll be setting up all the queue lines, figuring out, like, I'm going to be sanitizing the mic and or mics, so figuring out where I'm going to position my chair. So it's really those last minute details, and then we're going to do a general walkthrough with all of the stakeholders to make sure that we've got the signage and we're directing people properly, and that the corral is easy enough to navigate, and then if there are any last minute adjustments, we're going to try to get those all taken care of Friday, and then Saturday morning we should be we expect to be all set.
So unlike regular town meeting where you're there every night, it's just you sitting there over there with the rest of the administrators and so forth. And I mean, what are you going to have on as far as staff and volunteers for the health department? So what are the numbers like?
So really, it's just I'm the only one who's going to be there from the health department.
You're gonna hold down the whole place, huh?
Yeah, I mean, I was before Casey, and and then to that point, I mean, my two other staff members, they're not residents, and both are one could say that they're both they could be considered highly susceptible. So it's
Sure.
For them, it's why introduce unnecessary risk. And that's one of the things that we've done throughout this whole process is we've looked at if everybody is separated by 6 feet, really we've further reduced the risk, and we've looked at that's why we're holding it outside. It's safer. We can it's just a better risk calculation. We've got we'll have a separate seating area for the select board members, so there'll be enough of a distance between them and the general public that they shouldn't play any risk or pose any risk to the resident participants. And we're just like with town elections, we're trying to make sure that we've engineered as many controls as possible to make this a safe and readily executable event. And then as Connor keeps on saying, this could be one of the fastest, town meetings that we
Yeah,
have.
I mean, this also could lead us into, future looks at changing, the 1, 2, 3 nights to one afternoon or one day,
Right.
one early thing. And being outside, I don't know if the gods are with us, but here we are looking at a high of 70 with a partly cloudy. I
Yep.
think it's going to be a fantastic day
Yeah.
for everybody. And, and I feel that people, I'm hoping, there are some articles that people are passionate about that will tend to sort of stretch things out like they do at a regular town meeting because they're passionate. However, I feel that they're going to move business along because you're sitting there with a mask on. You can't move unless you need to hit the facilities or something. But it's just, I think it's going to move great.
Yeah, and we've got I believe that the town administration has done a really good job at um, making sure that we're only addressing the issues that are critical to the town's operation, and then they're also they've taken care to make sure that the democratic process, the citizens' petitions are being heard, and everything else is or can be addressed in another venue, in a safer venue. So again, I argue that on all levels,
Yeah.
everybody that has been involved in the process has done what it takes to, again, make this as streamlined and as safe an event as possible.
I tell you, for something that normally doesn't cost a lot of money to run, your annual town meeting, we'll say if they did run the 2, 3 nights, you're talking custodial overtime, basically. Now here, you got the big tent erected. You're gonna have an audio engineer. You got all the extra police. Normally you have, a couple police officers. Now you're gonna have more. This is gonna be quite a costly event
It's,
to the town.
I went out and I bought hand sanitizer,
Sanitize
like
it.
all these little things that, I've got the wipes for the microphone, like, so you're right. And it's one of these things that, I'd say the majority, if not all of uh, municipalities are undergoing um, the same costs.
Right.
So Sean, I wanted to ask, I know you mentioned about everybody is assuming it may be a short meeting, but we're planning on bringing drinks and food if we're going to be there for a long period of time. Isn't that true that they've said if you're going to last, I don't know, 8 hours under the tent, you're going to have to bring something to drink or eat? That won't be a problem. Can you get in and out to take care of that? And also, what do you think? What are you preparing for? 18 hours? 24 hours? What?
Nothing like that.
Thank
Nothing
you.
like that. No, I'm hoping to be home in the early afternoon and take my kids out for a hike or something. I Again, they've streamlined even some of these more controversial, or just some of these articles that could be a little drawn out. I believe that they've worked the questions and worked with the people that have, or the residents that have brought these questions forward. Um, they should be able to provide a fairly fairly quick decision, and then there's a mechanism for the details to be worked out um, post um, post town meeting.
How about food and drink?
That we like we'll have some, like I intend to have some bottled water in my car, but I really don't expect it to be an issue to like really to go beyond or to go long enough where food is warranted. And then to that point, I mean, we don't allow food at the normal town meeting because of various allergy issues. Um, I remember my first meeting when someone was eating peanuts. I'm like, what are you doing? This is a peanut-free room, and they just weren't aware and quickly exited. You know, disposed of the peanuts outside the room.
I'm waiting. I can't wait to Tom Gambini to go over the rules. Setting the bounds and all that.
Yeah.
Because I remember for years, and we talked about this when Dr. Collin was our moderator, that in the opening they always say, the warrant is posted at the two firehouses. Nobody goes into the firehouse anymore, especially in Woodville. That was a garage,
Yeah.
and nobody goes into firehouses. No use of electronic devices. Everyone's updating their Twitter when the articles change and the whole thing's changed. So I'm hoping that this is going to be the start of renewing how he does the layout of his meetings, which is going to be strange. The whole thing is strange this particular year.
I mean, just look at what it's done to business. I mean, my wife and her job went from being 24/7 at her office to she's got the flexibility of what I guess spending less than 20% of her time a month in her office. So there's this whole this is really shifting the way we look at doing business. A lot of like my wife and my kids commute used to be an hour plus to go into Boston each morning for school, and my wife's work is in Boston, but they've been making it there in 20 minutes. So that's a kind of just a testament on how few people are now commuting in to the city, and some of the expectations that I've heard are that it's not going to increase that much, even as we transition to further into phase 3 and phase 4.
Right. Well, I got a question in from good friend John Ritz. So he thinks it's less important than town meeting or the school opening, but as of today, if we look at today, and nothing was going to change for the next 6 weeks, how does Halloween look like? What would Halloween I can't even say it, Halloween look like this year if it was like to happen today?
I'm actually working on that.
No way.
I swear to God. I started on Thursday.
That was more of a shocking response. I wasn't doubting it.
Yeah, I know, but these are the things that people just I'd say the average individual wouldn't even consider that the health department is looking at all this stuff. But we're looking at do we we may hold like a trunk or treat, and if we held a trunk or treat, how would we do this? Would we do it by school? Would we do a large just, and how would we engineer the candy transaction, and how could we do it to support just the fun and novelty that is Halloween, and I'm looking at that from both my daughters and their schools standpoint, and said, well, I can easily translate this into Hopkinton, and then let's figure out what other steps we can take to provide a Halloween experience. That said, it's not going to be, again, like it was last year, in the years prior to this. we're going to have to set up some protocols for, and we may actually have to restrict some of the, like door-to-door activity, and any door-to-door exchange. But there are options, and that's one of the things that we've started doing is, how do we, what options can we bring? What options are most likely to work? And and it may be that the juniors and so I mean, actually, there might be high school kids that are interested in participating in a trunk or treat if maybe if we style it to that to that demographic, that kind of older student demographic. But these are things that we've started a discussion on, and our goal has always been to look at all of these situations so that we can at least try to provide the best experiences and the closest that we can to some normalcy.
Do you think it's safe to say that everyone will be required to wear a mask on Halloween?
And that's
That works, don't they already?
that works. I mean, and it, and or like if they're it like I participated in a trunk and treat event with my daughter's school for the last, I think, 3 years, and with them we're just going to have to add a little structure where where the kids will still be able to dress up. The candy exchange between will be at least at 6 feet, if not a little greater. The kids will be distanced at least 6 feet. They'll be wearing masks, but we'll have, and they'll go in, by family groups. But they'll be able to see each other. They'll be able to call out to each other. They'll be able to pick up candy. But it just takes a little engineering. And then we'll have a set of rules and expectations laid out, and then it'll be the responsibility of the health department and other volunteers to help execute and make sure that everybody's sticking to the rules that were set up.
Because I would think, of course, the trunk or treats became famous because of the Triple E threat,
Right.
and I would think neighborhood trick or treating would be better than the trunk or treats, whereas you got all these groups in the same parking lot. I think you get the more crossing and mixing of kids than in a neighborhood. The only problem is the neighborhoods tend to also have the little parties too, which I don't know. I sort of like the model, go earlier, hit the streets. Households, I tell you, leaving a bucket out of candy does not work. It'll be gone in 10 minutes.
Right.
Maybe throw it. Maybe we could have like a contest where you just throw the candy into the kids' baskets or something. I don't know.
Or it's pre-Ziploc, and like there are a variety of different ways we can attack this, but that's our challenge. Is it's very easy to say no, we're not going to have trick or treat. No, we're not going to have Thanksgiving. It's just, but that's just not the way that we look at things. It's we take each one of these events on and figure out how we can come up with a solution, again, to provide the best experience.
Well, if we could have a snowstorm shut down Halloween, this COVID could definitely do it. There's no doubt in my mind, but I think it could be done safely, and I hope everyone just uses their common sense to actually, do it smart. Be smart about it.
Right, and that's really all it is. It's just exercising some common sense, and the flu clinics that we're going to be holding. That's
on my list.
They're not going to be anything like your typical flu clinics because we're our flu clinics they serve two functions. It's A, to provide the flu vaccine, but
Right.
B, to practice for the eventual, COVID vaccination.
Exactly.
And so we're looking at different models. And then what we thought we were going to be doing 2 weeks ago changed because, you know, the the big mass order of flu vaccine that we put in is being distributed to us in
Segments.
smaller segments. So, so we're going to offer a limited high risk dose or high dose, and then probably a children's, and then um, one that's open to the general public, and then we'll go back when we get the next supply. Um, but this will give us the ability to really work on um, our system, and then to that point, Casey's office is, I believe it's fully, I believe it's complete, and so we might be able to provide something either in our office or outside of our office for a certain number of hours a day. And that's another thing that we're trying to figure out. How can we best, serve, the residents of Hopkinton and the employees of Hopkinton, given these different structural limitations or supply, um, limitations.
Well, as it turns out, John, for me, I've already gotten my application for the high dose flu shot. And I've called in to set up an appointment, and I've been given an appointment time for myself and my wife to go to the senior center, drive through and get the shots. And there's a application form, some kind of health form that
Yeah.
gives the my health insurance besides Medicare and information like that. And then I get a health check while I'm there to make sure I don't have anything that would prevent me from getting the shot. So I'm looking forward to trying it on the 17th to see what happens. I noticed that they only had a window from, I think, 10 o'clock to 2 o'clock. And now I understand that may be because of the limited amount of serum you have for the virus injections.
Right. And that's true. And then, and the to further confound all of this is we submit our flu vaccine request back in, I think it went in late January, early February, before any of this happened. So our original numbers were based off of what, the last 3 years participation was. And then we pushed it up a bit. But, given everything that's happened, we are, and then with the governor's requirement that all children be vaccinated, they've opened up, for additional orders. And then we have the ability to go to or to draw from certain other resources in the area for additional vaccine. But it's a process, and if nothing else, COVID is it's added a whole level of process to everything we do, from Halloween to a vaccination clinic.
That makes me think of another question that I had earlier about uh, school is opening on the 16th. I think that's next Wednesday or Thursday.
Yeah.
Will a member of the Board of Health be present at the opening of school to monitor how the traffic flows in, how the students come in, watch for anybody that has any obvious symptoms? Will you be involved in that?
Yeah, we'll be involved in it, and then it's something I've already had. I had one conference call on it today, because there are just, again, it's a new process. We're figuring out, and we're identifying different issues every day, and then and we're still getting regulatory modifications. You know, one of these just came in, it was just modified on the 3rd. Actually, it's, yeah, this one. So, and we expect to have a couple more regulatory modifications between now and when they open. So, you know, like I'm meeting with the school committee today or tonight. And as I said, I'm on the phone. I've been on the phone every day with Dr. Kavanaugh and her administration. But it's an interesting. I mean, it's a complicated process because you're trying to control for, you know, multiple variables. But, you know, we believe that we've got the building is in good. All the buildings are in good shape. We've got controls, policies, and procedures in place to minimize the risk that might exist either on the bus, at drop off, and during the day. And really, it's up to you know, the parents making sure that they're not sending sick kids to school. It's up to, you know, each individual participant, be it, you know, like individually as a health director. It's my job to make sure that I'm not coming to work sick, that that I'm managing the risk within my household, so I'm not transferring any risk that might exist in my household here to the fire department. And it's the same issue with all of the school staff, all of the teachers, that they have to figure out where their risk exists, you know, with their own habits, with, you know, what goes on in their household, and they need to make sure that they're controlling that risk and not introducing it to the school system. And if we're all doing our part, you know, we should have a successful school year. But it's all, there's so much unknown out there that but it's the unknown that exists outside of the school, that is the one that's really difficult to control for. You know, I was just looking at our numbers. We had a slight increase over the last week of people traveling. I think we're up to 435 or so that have traveled in and out of Hopkinton over the last month. And now we're trying to manage, and we're working with parents right now to try to figure out how to manage their kids that are at college who might be being sent home, or they might be ill. And, you know, how do we manage and plan for Thanksgiving and Christmas? And, you know, do kids in high risk states have to quarantine for 2 weeks before coming home? Or, you know, like, how are we going to work all this, you know, out? It's yeah, I mean, like I said, everything is just it's a process.
So how soon would you think school opens on the 16th? How quickly, if you saw numbers that either move up or down or stay the same, I mean, how if numbers started going up, would you see it in a matter of days? Would you see it after a week? If there was any increase?
Like, it'd be about a week. Like right now, we're monitoring our numbers for Labor Day weekend. We you know, you can see it in you can see some effect in the national statistics, or like at colleges where you know, the kids might have let loose before they arrived at college or while they were at college. And there's, you know, that's why some of the numbers might be increasing. Like, I'm monitoring all of the statistics coming out of Boston and Boston's colleges. I'm also monitoring what's going on at my daughter's school. I mean, my
Yeah.
daughter's school, they're back full time, full. They have a remote option, but they're back full classroom. And so what we're doing is we're monitoring all of this data to help calculate, all right, what are those, like, I personally think it's the first 14 days that will be critical. And then, and I expect people to identify some oopses, like just, and have to adjust maybe the way that they handle themselves outside of school at home. You know, it's one of these things where, you know, if I'm an employee of the health department, um, I know that I can't be going out doing all this high risk activity and expect um, that not to have an impact on the performance of my department. Um, and by God, if I introduced something, you know, an illness into my department, you know, that would crush me. So
Yeah.
it's, everybody has to kind of take note that, you know, what they do on their free time will have an impact on, you know, the success of the school reentry. Um, and that's why, you know, I credit Dr. Kavanaugh in stating that, you know, what we really wanted, you know, the residents in Hopkins to do was to kind of have a quarantine light as we, you know, approached next week, where, you know, they weren't taking their kids out to high risk states, and um, you know, we were just focused on getting everybody set for reentry. And if we're controlling that risk and recognizing where that risk might exist within our social circles or just outside of our social circles, um, that they're controlling for that. And then again, if everybody's doing their job, I believe we should have a successful and safe reentry. But
Yeah.
it takes work. It takes a lot of decisions to be made, and
Yeah,
you know,
it's a shame too. I mean, I hope that, and I see where staff has been added, but I'm hoping that whether they use their paraprofessionals or their teachers, volunteers, or whoever, parent volunteers, I guess they call them. I'm hoping to see that they use them to do the monitoring instead of just the teachers, and let the teachers focus back on just the teaching of the kids and not have to worry about, okay, how much hand sanitizer you got left, you know, whatever. I'd like to, you know, like when I coached Little League, they came up with all these rules in Little League, like no on deck batters, and you had to have your parents do a couple hours on game night to work the doghouse and all this stuff. But they only gave us an hour and 15 minutes of practice every day,
right,
and three times. And so I got my parents' first meeting. I had my assistants play with the kids, and I had to sit down with my parents and said, "Look, I got to manage all this stuff here." I had one person handle the raffle sales, had another one handle the doghouse staffing, another one handle this. And this way here, I could focus on the kids, teaching
right.
them baseball, and it was great. So I'm hoping to see that's more in place, and I'd love to see the kids policing themselves so the teachers can focus on the job at hand.
Yeah, and it's, you know, like, you know, from our last show, you know, I had a had a tree limb come through my roof, and sat there and went, all right, this is something new that I have to deal with. But then I said, well, this is no different than everything else I do in my life. I have to set expectations for the people who are, like, for the insurance adjuster, for the people that are coming out to assess the home. We have a set of procedures, you know.
Yeah.
they get out of their truck, they have their mask on, they meet me, we're distanced. I have a ladder pre-set up. They know where the location is. We try to keep our meeting as brief as possible. Our long-term, our longer conversations, etc., are all done over the phone. But and if they have to come in, they those that want to come into the house, I've got rules set up for, you come in while my kids are at school, and I'm managing all that. It's an involved process, but that is what I'm doing to ensure the safety of my own health and my family's health. And just like you did with baseball, it's setting up the rules, the expectations, and then if everybody follows, the rules and expectations, we should be fine. And as we saw over the summer, even when there was where there was an umpire in a different league who tested positive, they were masked, they were distanced, they had no interactions with no direct interactions with the participants, and we didn't see any spread of illness from that event or several others that came up, at different events or in different exchanges, and it's just one of those things that it helps to demonstrate if people are following the basic rules, we can do this safely. And is there 100% compliance? Here at the, in our municipal offices, we're probably at 85 to 95%. But it's because there are enough people doing their job and taking care of that risk. And when they have questions and concerns, they follow up with Casey and I that, we've been successful at controlling that risk. And again, the same applies as we get into school and as we start, opening up, all of the different events that we're looking at. So, it's different. It's not easy, but that's, what we got to deal with. And at the end of the day, I think we'll be better off as a community. Like we'll know how to control flu and other stuff better in the future. We should be a healthier community because in theory we've learned a lot about how to prevent infection. And yeah, but it's like I said, it's just been a process.
So Shaun, can I ask, I'm trying to formulate the question in my mind. I understand that there's a possibility that there may be a vaccine soon, maybe next year, beginning of next year. I don't particularly believe that a vaccine will eliminate the disease. Obviously, we've had flu vaccines around for a long time, and that hasn't eliminated the flu.
Right.
But do you feel comfortable that the things that have been learned over the last 7 or 8 months with the COVID-19 give you a better shot of seizing the source and stopping the spread, and then even treating the disease after it's been found?
Yeah, I mean, you look at like you look at like New Zealand and some of these other countries that they didn't have access to a vaccine. They did a hard lockdown. They implemented the same strategies based covering distancing, enhanced hygiene, and they were able to defeat this. So I think that when the vaccine is available, if we're still practicing these same behaviors, we should be able to eliminate this. And it's still, the experts out there still believe that if we could get everybody on board, or at least enough people on board, that they were wearing their masks, that they weren't just were avoiding large crowds and gatherings, that they're distancing when they were in these environments, that we could control it and really drop our numbers. I mean, what have we done here in Massachusetts or New York City? It's really just, we've implemented some very simple strategies and we're controlling it. And I get calls from parents who are like, well, look at how bad things are in, the southern states with their return to school or return to colleges. But I'm like, but they weren't in the same situation. Like, they've got much higher, infection rates, and their positivity rates are much higher than ours. So, like, I believe as a state, we're in a good position. And then if we just continue to practice what we've been, what we have been since, March, we should be in good shape. And again, with the vaccine, we should be in better shape. It's, and it just, yeah, it's really, it's all controllable.
Yeah. Well, again, the vaccine, it is far enough away, and the stories coming from all places. Oh yeah, fast track this, fast track. Oh, we got problems now. We're not fast tracking. Oh, this is all going to be fixed by November 3rd. You have all these scenarios, but I think what's important is that we're still updating things on a weekly basis, because the information is changing so much. And but you don't know. I mean, you can't. No one can predict. I mean, you can't predict anything. It's just that you want to give your best guess based on the way it's flowing, and that's why people got to understand the word model. It's a model based on the numbers. It looks like it's going to go like this. All the numbers change. Okay, now it's going to look like this. You got to understand, and I think a lot of people are getting it. I just think a lot of people are just frustrated over it.
Right. I mean, that's why messaging is important. That's why having a well drawn out plan on who is going to message what, who's in charge, and what's the process. I mean, that's like, as much as Casey and I have done, I credit a lot of our success to the chief. Chief Slayman helped set the process that we follow, and helped us establish the structure for communication. We have a communication team that they basically they send us a couple emails during the week on what the focuses should be, and then they manage that so we can do our job. If it's this is all, as I said, it needs to be a well established and communicated process, and I would argue that it hasn't been. There's still a lot of people talking about, like, to your point, how there was a communication out of the White House that the vaccine would be ready and that the state should prepare to dispense it in November. Well, the actual communication was that the states needed to prepare to possibly open up additional logistic facilities to support the distribution of vaccine. And so all the states were put on notice that, people like McKesson would need to possibly open up additional transportation facilities and holding facilities, and that those facilities should be strategically placed by, places that had dry ice or enough power to supply the refrigeration that would be needed. And that's what the communication was. And everybody go, oh my God, the virus is coming out. It's like, no, it's the plan to distribute the virus. Not the virus. Vaccine.
We're already distributing the virus.
That's all I'm playing into some QAnon. And honest to God, that is, like, this is something that that we have to deal with. I can admit that I've had to address a whole bunch of, no, I'm not part of some conspiracy to distribute. And then it got to the point where, I'm having discussions with public safety because there are, there were individuals out there that thought that, maybe, that the public health directors were part of some, undercover conspiracy. It's like it's been an interesting, yeah.
So, okay. Now, what can the public do to help you as far as getting the word out about the flu clinics, and how can they volunteer? Do you have all that information, or is that a Casey question?
Casey's handling a lot of that. What we do, we do encourage, um, parents to be in communication with their primary care physicians and their children's primary care physicians to be, because that obviously that's the primary source of vaccinations, and to make sure that kids they're getting that they're getting their normal vaccinations, that they're getting checkups, that that we're treating, we're not only for like the flu, but if your child has allergies or other issues that could be possibly confused with COVID. We've seen that residents in town have displayed COVID-like illness when it was tick-borne. So we just need everybody to, start having those communications with your physicians, put plans in place to get vaccinated, be it at your physician's office, at your local pharmacy, or through one of our clinics. But we're encouraging everybody to really focus on their personal health and their family's health. And if we're all really vigilant and we're following, these basic tenets, distancing, covering, hygiene, we as a community should continue to get better. And I mean, we did it over the last 2 weeks. We had an upswing that drove us into the green risk rating, and then we had a course correction, and we're now back to what we have the lowest positivity rate that we've had, I think, in the entire 6 months. We're down to like 0.11. We're back to that unshaded category, and we're in a much better position, a much better position than some of our neighboring towns. And the fact that we've done that gives us options. It allows us to have sports. It allows us to take into consideration, whether or not they could hold a knitting circle at the senior center. I've never had people so happy that the knitters were elated that they were able to get together.
Get the same group of people that dying to get back in bingo. The bingo halls shut down. You need 80 to 100 people to make it work, and we can only have 25. And then they says, "Oh, just have it outside." And it's like, no, this type of people aren't going to sit in tent, use porta johns, and
right.
You got to make it functioning for them. And then they're a long time. If bingo starts at 1, then they're at 11 setting up their tables.
Right. And right now, I mean, that's the next challenge is, so we get through town meeting, we get through the school opening, we start monitoring and managing the school's operation, but we can't sit back. Now we have to focus. How do we work with the restaurant owners?
Yeah.
How do we transition from this outdoor environment to an inside experience? How do we continue to assist them with their return and maintain some source of profitability so we don't lose anymore? Like this is, it's just a constant set of issues that we're being drawn on to address, and this is the stuff that I've already had conversations with people about, so what can we do to increase the seat back height? What can we do? Can it be 30 degrees out and we have outdoor seating, um, you know, at a restaurant? Like just so at the end of the day, we're both, my department is vested in continuing to push everybody into that return to normal and to support the businesses that are operating as best as we can.
And we have a lot of facilities in town that people take advantage of, or at least in my case, used to take advantage of. The senior center, the library, for one, I'd love to see that open again.
Right.
Those things are just off limits for now, but hopefully they'll be starting back soon.
Yeah, and we're looking at all of those, and some of that is being looked at on a statewide or on the library groups across the state are trying to figure out what is their best, what are the best practices for them to open, and what functionality can they provide, and maybe they'll do it in a phased approach. And we're looking at the same thing with the senior center is how can we open up the senior center safely to provide additional services without compromising the health of our residents, and then what services can we bring to the seniors. And throughout this whole ordeal, there are issues where people are, we're seeing more clutter and other issues in the homes. So like my department's been trying to bring in resources to help people address those things, those issues at home. Like I said, it's been a busy 6 months.
Oh yeah, it has. So got a question in on the social media. What if like 400 people show up for town meeting? Are they going to limit the amount of people? So could you explain that first?
No.
Well, we do have. I know there's 200 for the tent, right?
I'm going to have a big bag of chalk, and much like that rainbow, I will be working with and these are the things that again, I credit the chief and Deputy Miller. I mean, they're like, we have to have a plan in place for everything, and because the last thing we want to be caught is flat-footed. So if 400 people show up, we're going to have to adjust some of the traffic flow, and then that's why we have the additional patrolmen out there, is to they'll start communicating that we're getting a larger number than we anticipated, and then that's when a group of us have to roll out and start, I'll have measuring tapes and all of that, and we'll start marking locations. I mean, it might be that some people have to stand. I've got a few beach chairs in my car.
So I was going to bring a couple of those, but the basic, I guess, thing to do is town meeting starts at 9:30. Don't show up at 9:30. Get there early. The registration starts at 8:30.
Right.
Get there, pack your butt, stay there, vote away, and go home. I think that's the advice I would give everybody. Get there early. You know what it's like to go to a regular town meeting and register and find a seat to sit. This is 10 times worse.
Right. Although it won't be as stuffy.
Definitely won't. We got the weather report. The weather's gonna look fantastic.
And like I said, they've done enough planning ahead to streamline this process so that my hope and expectation is that this will move along quickly, and and we can we can complete our democratic duty and get our votes in and proceed into the next fiscal year. And then, we can do so safely. And it's, again, like you said, it's planning ahead. While it normally takes me 5 minutes to register, let me give myself 10, 15 minutes. And we will have, like, I know the deputy chief and I are going to be marking out all of those queuing lines.